Hi there, how are you today? Today, I want to talk about dealing with a loved one who's been diagnosed with mild cognitive impairment, or MCI, which I touched on a little in Navigating Memory Loss and Alzheimer's, which you can watch on the Focus Your Time YouTube channel or listen to on episode 79 of the Focus Your Time podcast. So, just what is MCI? MCI is a condition that involves cognitive changes that don't interfere significantly with daily functioning or independence. In fact, the Alzheimer's Association website says that mild cognitive impairment causes cognitive changes that are serious enough to be noticed by the person affected and by family members and friends, but do not affect the individual's ability to carry out everyday activities. MCI can develop for multiple reasons, and individuals living with MCI may go on to develop dementia, others will not. The National Institute of Aging says that there's no single cause of MCI. The risk of developing MCI increases as someone gets older. Conditions such as diabetes, depression, and stroke may increase a person's risk for MCI. It goes on to say, signs of MCI may include losing things often, forgetting to go to events or appointments, or having more trouble coming up with words than other people of the same age. Movement difficulties and problems with the sense of smell also have been linked to MCI. Someone with MCI may experience difficulties with thinking, language, and decision making. And if you or someone you love is experiencing cognitive changes, it's best to consult with a healthcare provider for guidance. MCI is often considered an intermediate stage between normal cognitive changes of aging and more severe cognitive decline associated with conditions like Alzheimer's disease. Receiving an unfortunate diagnosis of mild cognitive impairment can be challenging, especially when it affects someone you deeply care about, such as a spouse. It's natural to experience strong emotions and question why this has happened. As a caring person, you may feel compelled to find a solution and take it upon yourself to research and get educated about the condition. However, it's important to understand that your loved one may not be receptive to making changes or adapting to a new and different lifestyle. They may prefer to remain in their comfort zone even when it's not beneficial for their overall well-being, simply because their current lifestyle brings them happiness. One aspect that can contribute to your own frustration, especially after all your research, is witnessing behaviors you may not necessarily agree with. You also may have a strong desire to encourage activities that promote brain health and potentially prevent further progression. Again, you may observe your loved ones spending hours playing video games or engaging in negative content on television or online, or maybe they consume an abundance of processed foods or resist socializing or exploring new activities. While your loved one's activities may seem unhelpful for their condition, they might be serving as coping mechanisms. Even though we might not understand why they continue to do these things, it may provide them a sense of control. And even though we can't change the behaviors, recognizing their possible benefits may create an environment that helps them navigate the MCI experience more comfortably. If you're living with a spouse or someone diagnosed with MCI, here are some helpful suggestions to consider that can help you help them. Encourage daily habits and routines that promote structure and provide a sense of stability. These include set wake-up and bedtimes and meal times. If your loved one likes to concentrate on home projects, let them, and do your best not to interrupt or distract them so they can focus. Assemble and cook nutritious meals that create blood flow to the brain to ensure proper nutrition for both of you. These types of foods include blueberries, leafy greens, beets, and walnuts. Keep your home clutter-free and put things back where they belong. This helps because it reduces confusion and makes it easier to find things. Provide written notes and simplified instructions and leave them in a prominent location. This will reduce potential confusion. If you have appointments or activities planned, make sure you immediately put on both of your calendars. Also, make sure important dates like birthdays or anniversaries are on the calendar as well. Accompany your loved one to medical appointments, ask questions, and take notes. You can even record the conversation on your watch or phone so you can listen later. Ensure your loved one takes prescribed medications at the correct times by setting reminders on the calendar or phone. If socializing is overwhelming, limit engagements to a couple of hours in order to prevent overwhelm or flooding. To keep your home organized, clean, and to ensure everything is turned off when you leave for an extended period, it's helpful to create a checklist that serves as a reminder of tasks needing to be completed before your departure. This helps you maintain a well-managed and secure home environment. Suggest coordination activities such as ping pong or pickleball. You might also suggest dance classes, learning a new language, or learning a new skill. All of these things increase blood flow to the brain. You may also create a list of your loved one's strengths and all the things your loved one still can do instead of focusing on things they can't. While you can do everything you can to make your loved one's life easier, being with someone who's experiencing memory issues can be challenging, overwhelming, frustrating, and lonely. It can be unsettling and worrisome when our loved one struggles to recall recent conversations, repeats statements, asks the same question multiple times, makes up answer to fill in the blanks for short-term memory loss, or hyper-focuses on one thing. In challenging moments like this, it's natural to react negatively, including instances where we may unintentionally shame our loved ones, which can lead to feelings of guilt because it's our loved ones who are experiencing memory loss, not us. However, it's important to remember that we are human and there are limits to our patience. Practicing self-care when dealing with this type of environment is crucial, and I'm going to give you some helpful coping strategies. Research and educate yourself on the subject of MCI, its symptoms and challenges. This can foster empathy and patience. Attend in-person or online support groups with others who are going through similar experiences, or seek therapy or coaching for coping strategies. Realize that occasional negative reactions are normal and not a reflection of your love or commitment to your loved one. Find solace writing in a daily journal or practice mindfulness or meditation. Make a point to visit with family and friends and proactively join meetup groups, take classes, participate in new experiences, learn new things, and engage with others. This is a great way to make some new friends. Make it a priority to establish your own daily self-care and wellness routine, regardless of the circumstances. Before going to bed, do a brain dump by jotting down your thoughts and worries on paper, which helps clear the mind and promotes a restful night's sleep. Maintain a clutter-free calendar by adding activities that genuinely interest you and politely declining those that hold no appeal. Read or listen to positive audiobooks and podcasts. It's crucial to practice patience with yourself while navigating the challenges of supporting someone with mild cognitive impairment. Prioritizing your own self-care and taking steps to maintain your own brain health can benefit both you and the person you're assisting. By implementing coping strategies, you can work toward maintaining a positive and compassionate mindset as you navigate the challenges of caring for a loved one with MCI. If you or a loved one is having memory issues, it's best to contact your healthcare provider for further steps. I came across a useful online assessment called the Quick Dementia Rating System that can provide an evaluation of potential cognitive issues or mild cognitive impairment. You can print and complete the test and then share the results with your healthcare provider, and I'll include the link to the assessment in the show notes. To learn more about MCI, I'll include the Alzheimer's link as well. Do you have a loved one who has MCI? Leave a comment and let me know if any of these tips helped you in any way. Maybe you have some coping skills or self-care tips that I didn't include. If so, I'd love it if you'd share them in the comments. Thanks for joining today. That's all I've got. For resources around simplifying your life, personal growth, or productivity, or to download some helpful freebies, or to learn more about my program, Broken to Balance, visit my resources page at focusyourtime.com/resources. Have a great rest of your day. Bye.